I was short by half a mark. That was a devastating blow, obviously. I know my medical knowledge might be here, but the patient's medical knowledge might be here. And it's about how to address that gap to bring the patient on the same level to them. In difficult cases, could be learning difficulty cases, bringing down the language, the tone, your demeanor back to, and your appearance, to their level.
When it comes to breaking bad news, it can be very challenging when you have emotionally charged patient. How did you find the breaking bad news scenario?
Yeah, so at the breaking bad news scenario, and I knew that was one of my sort of weaker area, and it wasn't so clear because in the exam you're not quite sure if this is going to be a breaking bad news case or whether this is just a standard case, but there was some element of a negative news.
Last time you missed it by half a mark, but then the second attempt that you did, you had a really good margin. And then does it feel now?
It hasn't sunken in yet.
My guest today is Dr. Gordon, who recently passed his SCA exam. It was his fourth attempt after failing the RCA twice and failing the SCA once. Hi Gordon, how are you doing?
Oh, I'm good, Owen. Thanks for having me on in here. Just in a privileged spot to be able to have a chat with you today about my experience. And, as Erwin mentioned, I failed my RCA twice and failed my SCA once, and the last sitting was my fourth attempt. I guess I really struggled with the exam format itself. Going into it, I wasn't sure what would be coming up, how to prepare for it. And Erwin's course, when I chat with him initially, gave me some pointers, and the course was really helpful.
What didn't work in your first preparation, Gordon?
Yeah, I guess the first preparation, as in my RCA, there wasn't much guideline on. There were set of videos that needed to be recorded, but these were real life patients, so it's different to what the examiners were looking for. I was short by a few marks every time, and I didn't know where else I can progress. And then when I sat the SCA in January, the limited information came out about what the format is. You have some information from the college itself, but not everything were available to you, and there's a lot of guesswork involved. And when I found out that I didn't pass my SCA exam, that's when I contacted Erwin, told him what my difficulties were, told him, what I've tried, how often were I preparing, but yeah, I still wasn't getting the results that I was after. And that's where he helped.
So what was the score you got in the first attempt?
Yeah, so with the SCA, the pass mark was 75. I achieved 74.5, so I was short by half a mark. That was a devastating blow, obviously. So close, yet so far away. It felt like this block that I wasn't getting past it. And that's when I reached out for help.
So when you were preparing, there were things that you were doing well, and then there are things that you were not doing that well. So looking back, what are the things that you think you had to change, Gordon?
Yeah, so when we're practicing with private groups or with small numbers that you might be doing now, you will find that the answer, that yes, there might be some complication, but it's because these are your colleagues or these are your friends. It doesn't replicate, what the examiners are looking for. So you don't really anticipate, what might be the difficulty in the management plan. And I guess Erwin's course, gave me that kind of bit more extra insight, because I was practicing almost every single evening with my colleagues, doing different cases, making sure that I got the management right, making sure that I've got all the data gathering as well. But yeah, it didn't translate. And it wasn't until, Erwin said, actually, you should look at it from a different point of view, anticipate, what the question is, do the prep work. So the first 3 minutes, that reading time is actually is quite valuable. Before I looked at it as a piece of paper, but a bit more information, but actually that information can translate to help you to manage and do the management plan.
Okay, so the priming was something you changed when you're anticipating what was coming in the consultation. And how did you structure your consultation then, Gordon?
Yeah, so my structure was in a 12-minute consultation. The first 6 minutes will be on data gathering. That will include my ICE, my ideas, concern, and expectation. That actually gave me an idea what the patient or what the actors are thinking in their mind. Then I'll be able to use that information and reflect on it, and then come up with a management plan, which is a shared making, which is what Erwin's been emphasizing. And it's quite important to get that shared management plan to come across to score your sort of relating to others.
Yeah, so shared management is one of the aspects that a lot of trainees struggle with. When you thought about developing your shared management, what were the things that maybe you were not doing right at the time and had to change, Gordon?
Yeah, so the shared management for me, I felt it was a little bit forced. I felt like I know, what will be best for patient, but until you actually ask the patient and give them the option, you might not be that the answer might not be what you'd be expecting. And I guess that's where the relating to others are difficulty scoring high points initially in the scoring to or relating to others aspect. But through the Erwin's help and his teaching and his coaching, that definitely changed. Actually, these are the options, but it's about leading that the best option for the patient, and then see if they're on board with it, and then from there develop a plan going forward with them.
So, when it came to your preparation, the things that you changed were how you approach the shared management. You also changed the way that you're priming the consultation. Tell us about in your day-to-day work. Were there any things that you were doing that helped you with the exam?
So in my day-to-day work, I get allocated 15 minutes per patient, and that included 12 minutes to stimulate the real time, no, the exam, and 3 minutes of the reading time. By having 12 minutes, or 15 minutes, including typing, that allows me to get a better understanding of what the patients are looking for, how I can address their needs. And sometimes it allows me to give me a better focus on the clinical aspect of it, and then developing a shared management plan, whether that is, to start medication, whether that is for follow up, or whether it's a combination of both, or further investigation, like trying to find out the missing pieces. And I guess that time, because I'm not feeling rushed, I'll be able to address what the patient's concerns are and their ideas, and what they expect from this consultation.
Yeah, so the patient's idea, concern, expectation is critical for the SE exam. And also, the psychosocial aspect is also very important. One of the things that a lot of trainees are very good at is medical and doing the medical part. But in your experience, how did you have to integrate that in your consultation? Because sometimes it can be unnatural.
Yeah, you're correct. So asking ICE question in a clinical setting might not yield the result that you're hoping for the exam. That's purely because the patient coming to see you for your opinion. But ultimately, ICE helps you as a tool to help you to understand the patient's mind. Some of them, patient might say, "I'm not sure what's going on. I want you to take charge, and I don't know what I need to be worried about. As in, I've got no concerns, but I expect you to do something about it. At least this will give you a groundwork for you need for your eyes, and then you can reflect that back in and work it into your shared management. And from there, you can address their concerns first, address their ideas, and then develop how you're going to take that further by having the management plan.
Yeah. So another problem is managing uncertainty. When it comes to cases that people are good at, they don't have issues. But then when it's something slightly unfamiliar, then it's maybe more challenging. How did you approach that?
Yeah, so I guess with the exam, there's always going to be uncertainty built in, and it's about trying to risk manage. So for me, risk management, I like to be on the safe side. So I want to find out as much information as I can that from the data gathering itself, find out about the concerns, about the worries, about what, and then what I can do for them, and then going through a logical step of, let's say, okay, if we're not sure what's going on, these are the risks that I want to minimize, as in risk which will cause some acute harm, and then from there, we can think about long-term harm and what I can do in the meantime to mitigate that risk, whether it is by organizing some blood, whether that is, let's say, in condition, let's say in sexual health, what I can do to minimize the risk of passing certain disease and certain infection on, and how I can address that in an appropriate time and appropriate manner.
Great. So, from what you were saying to me earlier before we record, is that in your practice, your supervisor didn't have any issues with you. Your patients love you, and but for the exam, there was something that was missing. Looking back now, what do you think were the things that you were missing? Are you feeling unsure about the SCA? Maybe you don't know what to do, or you don't know whether you're doing the right thing. If you'd like to get a free copy of the SCA blueprint, click the link down in the description below to get access to the SCA blueprint that GB trainees have already used and passed the SCA exam. It's completely free. Just click the link down the description below to access to it.
I guess sometimes my consultation can be quite straightforward. It's almost felt as a like doctor patient, but in the exam they want to be doctor and patient on an equal level, and it's about coming to that shared management. I know my medical knowledge might be here, but the patient's medical knowledge might be here, and it's about how to address that gap to bring the patient on the same level to them, or in difficult cases, could be learning difficulty cases, bringing down the language, the tone, your demeanor back to, and your appearance, to their level, so that you have a shared understanding of what is going on. And I think that's the bit that, your course helped me to address, finding that balance, how to get my medical management across to a language that patient understands.
Great. So adapting your explanation and your consultation tailored to the patient so that you and the patient are on the same page then.
Yeah, that's correct. Yeah.
Okay. So in terms of the day of the exam then, how did you go in on the last one that you did?
Yeah, so my exam was in the afternoon. It started scheduled to start, I believe it was about 1:30. So I checked into the practice around 1:45, got all my internet connection set up. I had the whiteboard in front of me, so there were a couple of things that I just wrote down. So like things like do not miss are your red flags. Things do not miss are your share management, and then your potentially your follow-up. So these are kind of things that, so even if I didn't have my, I got flustered, even I wasn't sure what the patient's coming in for, I still have a structure in my head, which is actually data gathering, be done by 6 minutes. Along with that, your ICE, and then readdress the ICE early on in your management so that you have a shared understanding with the patient. And then the final sort of 1 minute or 1 minute 10 second will be summing up and then providing either a quick summary or for providing a safety netting and maybe follow up if needed.
That's great. So you had a clear structure in your mind so that whenever you had issues or you're not sure, you still knew how to progress your consultation. One of the problems that trainees face is when it comes to breaking bad news. It can be very challenging when you have emotionally charged patients. How did you find the breaking bad news scenario?
Yeah, so on the breaking bad news scenario, and I knew that was one of my sort of weaker area, and it wasn't so clear because in the exam you're not quite sure this is going to be a breaking bad news case or whether this is just a standard case, but then with some element of a negative news. So it's really difficult to give a generic guide, but I think one of the things that Erwin taught me was actually don't force it, don't push it. Let the patient, let them initiate that response. Those, extra 5-10 seconds might seem a lot when, you have your timer counting down, but it's actually waiting for the patient or waiting for the actor to give that initial first response, and then you can readdress what they're going through. They might be speechless, which my case was, or they might play it down, be a blasé patient, which I know other candidates had. And it's about how to address and manage those kind of patient and what they're expecting. If they're shocked, then you provide words of encouragement. If they're blasé patient, then you want to bring in the focus. Actually, why am I concerned? Share that with them so that they understand why you're concerned. And if they're sad, then obviously you give the words of encouragement. Say, actually, it might not be the bad news, but that's one of the things that we need to look into. And it might be the good news is actually we're just being overcautious, which is fine.
Yeah, that's really good that you're giving the nuances because some people have been told something to do in Breaking Bad and they keep doing just the same way. But you have to calibrate your consultation based on the patient you've got in front of you. So not every patient is going to react the same way. Everyone will have different reaction, and you need to read what's going on and then process information so that you can adapt your consultation. And you were saying that this exam tests a lot on the communication skill. What are the top three things would you say that you change in your second attempt in your communication skill, Gordon?
I guess the one thing that I changed was actually I felt going into it, I have a structure. So the structure was most important. Without that structure, it was easy to be lost. It was easy to be led by the exam itself, by the actors itself, going down different avenues, and you weren't getting your structure, getting all the points that you need. The other for me would be the breaking bad news. how to structure that the setting. Yes, we might learn about spikes setting, different how to set your stage, find out what patients know. But when it came to the exam, they add a layer of complexity into it, whether that's an extra family member who might be had extra complications at home or extra facts that you need to take into. And I guess the third part for me that I changed going into this is I felt actually, because by working into the relating to others, by having a good, making a good rapport with the patient, finding out their understanding, I was able to integrate that into my management rather than being a management led. Then you work in with your relating to others domain.
Yeah, so towards the end, I could see that you were able to organically integrate the patient psychosocial and make a personalized plan for the patient, which was really great to see how the data gathering tied in the consultation towards the end. When we look at the progression of the consultation, how did you make sure that you were on time?
Yeah, so I had a load the timer. When they came to the exam itself, obviously the timer counting down. So you introduce yourself, and then probably 15 seconds, then you start asking, your opening questions. It's about having a broad, that golden minute, maybe even golden minute and a half. In the exam, they'll be scripted to say, actually, just give a one line, and then for you to ask a little bit more. And I guess that's the trick that they want you to do is keep asking open questions until you get that script, and then you can go in and narrow down your close question, including your red flags, and then ask about the home situation, because that can tie into the second part of the management. And unless you ask, you won't know. And lastly, addressing their eyes. What is it, how come they left it so late to come here today, or why they come today but not yesterday or the day before or the day after, and then working your eyes. And then once you have that, I spent roughly probably around 2 minutes for the ICE, the ideas, concern, expectation, and it's, I guess, overall from the data gathering transition into a medical to psychosocial to ICE, is trying to minimize the jagged edges and make it flow nicely, and I think that's where the course gave me that information and gave me the confidence to do that.
Great. So it sounds to me that you put in a lot of work in your exam, but this time round you work differently and work smarter. So in terms of strategies, what do you think were strategies that you use to allow you to use your time effectively, Gordon?
Yeah, so the structure definitely was the most important part of the strategy. Having that structure in the back of my mind, even if it's written down on a sheet somewhere, it allows you to progress into different things. Yes, we might not ask every single question in the clinical data, or you might not ask every single question in the psychosocial, but by having the core aspect of each of the topic ready, you have an idea. You start building up that picture of the patient, why they're here today, and then what you can do to integrate that into the management plan to readdress their concerns, readdress their ideas, and then explain what you're going to for them and what you're hoping the results would be.
Great. So can you tell us what was your results then?
So the pass mark was 76 and I achieved 87. So I passed with a good 10% margin. So I'm quite pleased.
That was really good. So you last time you missed it by half a mark, but then the second attempt that you did, you had a really good margin. And how does it feel now?
It hasn't sunken in yet. I'm due to CCT shortly, and things are just progressing at a different pace. But it's all exciting times and it's all happy times.
Great. So, to somebody who is going to prepare and sit the exam soon, maybe they were not successful, what's the last piece of advice would you give them, Gordon?
Having that structure, and I guess the coaching from Erwin, that is definitely most important, I would say. Highly recommended.
Okay, so what's the reason you think that the coaching helped you? Like, in what way do you think it benefited you?
Yeah, that's a good question. It took me some time to think about actually how did your coaching or how did your teaching helped. And I guess when the first time we had scheduled the first session, you kind of gave hints and you kind of gave pointers, and you also stopped me when things wasn't going correctly. Whether that's me missing, certain aspect of, let's say, have you considered about their driving, where they need to disclose to DVLA, or actually, why don't we replay the last sentence, how we can integrate that into their management. And it's about intervening at the right time, at the right place, so that you have an understanding of what you can do going down a different pathway. Some of you guys might be attending different courses, some might be deanery run, and they would have the same actor as well as the ones that might be the RCGP organized, and there were examiners which are overseeing. You get feedback at the end, but by the time you get that feedback, it might be a little bit too late, because that feedback might be about 3 minutes late, and by 3 minutes you might have missed certain words, or you might have missed certain phrases that you need to work in at that time to get that feedback and incorporate it.
Great. So thank you very much for listening and watching up until the end. If you found the video useful, I'll leave a link down in the description. If you want to get in touch for one-to-one coaching, please fill in the questionnaire and then I'll see whether I can help you. Really lovely to see you, Gordon, and see how your career is progressing. So all the best, and thank you very much for sharing your experience today.
No problem. Thank you. Thanks for having me here.